And beginning our broadcast, keeping cattle healthy is crucial for producers because a healthy animal can mean a more profitable one. Market Journal's Maddie McIntosh spoke with an expert who shares some advice on a few of the issues your cows may encounter over the summer.
We've got a lot of standing water or some very wet, soft pastures. That often leads us in a situation where cattle are more likely to have some lameness issues, primarily the situation we call foot rot. And that's a bacterial infection that can be introduced into an animal that has any kind of a little abrasion or cut in between the toes, soft tissue of the hoof, and that infection then really becomes a real issue, causing soreness and lameness in that animal. And that's one that really concerns me this upcoming summer.
But producers shouldn't focus on only one disease. There are many different infections that can appear, and they all require different treatments.
Not all lameness, obviously, is going to be foot rot. And so I think it's critical that if we have some lameness, we visit with our local large animal veterinarian and have them correctly diagnose what's going on. If it's not foot rot, then the treatment will be very, very different. If it is in fact foot rot, a bacterial infection, then they'll probably talk to you about some antibiotic treatment that will be necessary to try to stop that infection. If we're in an area where we have fescue, for instance, as we go through summer months, we can certainly have incidences of lameness that are caused by fescue toxicity, which is something that is got to be treated very, very differently. An antibiotic will have no effect on fescue toxicity. So again, that's where your veterinarian comes in, that we get a proper diagnosis so that the treatment can be appropriate for the situation.
Once the disease has been identified, treatment can begin. This includes using medicine which could compromise the profitability of the cow down the road if proper steps are not taken.
Follow the BQA guidelines that we've talked about so many times before, and make sure that we keep a record of the cow that was injected, as well as how we gave it, if it was intramuscular or subcutaneous. Let's get the dosage that we gave, as well as the lot number of the product that we used. I'd also keep track of who actually gave the injection, and perhaps most critical is write down the withdrawal date. In other words, how long can we wait before we would ever market that particular animal to get them out of the herd if we choose to after we've treated. If there is ever a question as that particular animal happens to test positive for an antibiotic residue later on, then if someone wants to come back to the producer that sold that animal, he has the proof that he in fact did follow the instructions and the guidelines correctly. Perhaps something happened later on after he marketed her that would cause the residue, but he would have a chance then to protect himself from any possible legal action.
Glenn stresses that record keeping is the most important part of treatment, as it not only protects the producer, but the industry as a whole.
The situation with treating foot rot, I think, is one of those that we accidentally will let slip through the cracks, where producers will market a treated animal before the withdrawal date is actually taking place, and put us in a situation where we may be vulnerable to a violative residue. We don't want that to happen. Certainly following the withdrawal times closely is critical, not only for the producer who treated the cow, but also for the entire beef industry.
Reporting for Market Journal, I'm Maddie McIntosh.